Well, fortunately, we had a little extra time. Those of you who know me will know that I'm fairly obsessional, and so I did check it all this morning, and it was working, but we've got it working again. So I'd like to start by thanking the organising committee so much for inviting me to have the privilege of presenting a keynote address at this wonderful university. As was indicated earlier, I'm the guilty party. I'm the one who suggested we should come to Russia, and I'm very pleased to see that so many people have chosen to come to this beautiful city to attend the conference. So thank you very much to the organising committee for all their hard work in putting on the conference. Today I want to talk about violence risk and assessing violence risk, because this is a key task for many forensic practitioners across Europe and indeed across the world. It is one of the fundamental tasks that we have to carry out. And I think it's true to say that in the last 20 years there have been dramatic improvements in our skill, our technology, our understanding of violence risk, and how we might go about helping reduce the level of violence in our communities. And for those of you who work with individuals in hospitals and in prisons, you will know that there are now many forms of what we call structured professional judgment tools designed to help us assess whether people are likely to be risky in the future, and also help us manage that risk, to drive down the risk that people might go ahead and be violent. And there are now procedures for all sorts of different types of violence, whether it's general violence, sexual violence, spousal assault, stalking, indeed honour violence. A whole range of types of violence are now catered for, and we can assess in a very systematic way. And the core task then is to try and assess these challenging behaviours in an evidence-based way, in a transparent way, a way in which we know what we're assessing is relevant to future violence, and it's transparent in the sense that we know how we are assessing them, and other people can see how we've assessed the risk of violence. They're legally compliant, so they're not discriminatory in any way, and they lead to action. They help us manage risky people in a systematic way. So critically, these procedures are all designed to help us prevent violence. And violence prevention is really the theme of my talk. So those of you who know about the World Health Organization will know that they have regarded violence as a form of public health problem. And if you're interested in violence, the texts published by the World Health Organization provide very good summaries of different types of violence and the causes and the distribution. In a sort of epidemiological way, they describe different forms of violence. But why I'm showing you this is because I think the foreword is quite instructive. The foreword was written by Nelson Mandela, who was probably one of the most famous prisoners of the last century. And in this, Mandela says that no country, no city, no community is immune. Many who live with violence day in and day out assume it is an intrinsic part of the human condition. But this is not so. Violence can be prevented. And he's very optimistic. And I see a key role of forensic psychology, or one aspect of forensic psychology, is the prevention of violence. Now, as psychologists, we are very good at identifying individual risk factors which tell us about who might go on and be risky in the future. You know, has a person a history of violence? Do they suffer from personality disorder, particularly psychopathic personality disorder? Do they suffer from major mental illness? Do they have relationship problems? Do they have problems with substance abuse? Are they difficult to manage? All these things are known risk factors for future violence, and we're good at assessing them because as psychologists, that's what we're trained to do. But this is only part of the equation. People are only violent in particular circumstances, particular situations, particular contexts. And as psychologists, we're not very good at assessing context in a systematic way. And you really have to understand both elements, the individual risk factors and the situational risk factors, if you're going to understand and prevent risky, violent behavior. So, by increasing our understanding of situations, we can actually prevent violence. And that's what I want to talk to you about today. In the past, I've talked about individual risk factors. Today, I want to talk about the context, the situation. In particular, the places we keep people who are violent, in our prisons and in our forensic psychiatric hospitals. How can we alter the way that they operate to drive down the level of violence? And that is what I hope to talk about today. So I want to start off with a little theory about prevention and different models of prevention. I'll then talk a bit about my, what we would say in English, my murky past, some of my dark secrets, and then I will, not too much, and then I will talk about the development of structured procedures for assessing situations, whether it is hospitals or prisons, and talk to you about how that might be done in a systematic way and help us drive down violence. So let's start off by thinking about strategies for prevention. We go back to the World Health Organization. They talk about strategies for preventing disease. They regard violence as disease-like, and so they say that there are prevention strategies we can apply when we're trying to drive down violence. Now, in a general sense, there are two broad strategies for prevention. One is the high-risk strategy. So you identify people who are high risk, and you do something with them, and that reduces the level of the disease. So you might identify people with high cholesterol and high heavy weight and high blood pressure, and they are at risk of strokes, and you prevent the disease by working with that group. In our own area, we might take people who are high on psychopathy, high on the PCLR, and put them somewhere so they can't go around harming other people. So that would be a high-risk preventative strategy. But there's another complementary strategy, another strategy that you can use alongside, and this is called a population control strategy. And basically, you apply a treatment or a process across everyone in the population. And by doing that, you drive down the average level of a risk and therefore reduce the overall level in the population. This is called the population strategy. Now, one of the most obvious examples of this is alcohol consumption. Now, I'm very lucky. I go to Norway 2 or 3 times a year to teach in Bergen, and as a Scotsman, I'm always traumatized when I go there because the cost of beer is so high. It will cost me 10 euros, I don't know how many rubles that is, for a little beer in Norway. And they are using the price mechanism to try and drive down the consumption of alcohol. And in Britain, in the United Kingdom, we have had a natural experiment over the last 20 years. The average cost of alcohol has dropped dramatically, but the average rate of liver disease has gone up dramatically. It's a natural experiment which shows the impact of price on disease. And by affecting a whole population, you can actually affect the level of disease. And in a sense, when we come to work on an institution, by working on the whole population of the institution, we can reduce or increase the level of violence. So let me give you another example of this. This is a standard example. I'm sorry, the slides are cutting out. They were working this morning. Down here it talks about down the bottom here, it talks about the total level of cholesterol in the bloodstream. And this was in Japan, and this was in Finland, East Finland. So East Finland had a lot of heart disease. Cholesterol was regarded as a risk factor, and so rather than using the high-risk strategy, they decided to use a population control strategy in which they educated the population to eat more vegetables. They used public health methods to try and get people to take more exercise and so on. And over a number of years, they managed to reduce the average level of cholesterol in the population substantially. And this led to a halving of the level of heart disease in Finland. Because by moving the average or the mean of a distribution slightly, you actually have a big effect on the tail of the distribution, and that's where the problems were. So, how does this apply to violence? Well, the problem in our field, in violence, there are not any big risk factors. There are not many big, strong, powerful risk factors. There are lots of little risk factors which in combination go together to increase the level of risk that someone might pose. And this is important because if you're thinking of strategies for preventing violence, the size of your risk factors matter. And the classic text on prevention is this one here by Jeffrey Rose. And Jeffrey Rose talked about a thing called the prevention paradox, in which he said, and I'll just read this carefully, a large number of people exposed to a small risk, and our risks in violence are small, may generate many more cases than a small number exposed to a high risk. So you can actually end up with more cases of violence if a large number of people are exposed to a small risk. And this is when he says, whenever this axiom applies, it means that a high-risk preventative strategy is dealing only with the margin of the problem. So in our field, our risk factors are not very strong. And so if we use a high-risk strategy with individuals, we're not going to do a lot. We're only going to deal with the margins of the problems. Now, maybe you don't believe that, but let me try and give you an example of our risk factors in violence. And those of you who will know the field will know that the biggest study ever carried out was the MacArthur Risk Assessment Study. And in that study, they considered 132 different risk factors. And then they followed up patients, and they saw if these patients were violent in the community. And the strongest risk factor in that study was the psychopathy checklist screening version. And these are the data from the MacArthur study. And I just use this to illustrate the problem we have when it comes to prediction in our area. These are the percentage. I should start by saying, here we have the cutoff. If you're over 18 on this psychopathy checklist screening version, you're deemed to be a case of psychopathy. You're deemed to be psychopathic. And if we look at the number of cases in their sample of violence, 20% of them would be regarded as being psychopathic individuals. Only 20% of the violence occurred in people who were diagnosed as psychopathic in this, and that is our strongest risk factor. If you look at 80% were distributed in the following way. Now, it's not hard to understand why that is, because most of the people in the sample were not psychopathic. That's the distribution. But the point is, this is exactly what Rose is talking about. If we only deal with high-risk strategies, we're only dealing with the margins of the problems. We need to be thinking of other approaches, and the population approach may be one to consider. So, I think that's enough theory. Let me tell you a bit about my dark secrets, my murky past, and then we'll move on to talk about how we might systematically assess our institutions, our prisons and our hospitals in order to reduce the level of violence. So I started working in prisons in Scotland in 1984. Before that time I was treating depressed ladies in the posh part of Glasgow. Now, I see some of the English people here wondering, is there a posh part of Glasgow? Well, there is. But I must have been terribly wicked, because I ended up being sent to work in a prison in Scotland where we had some very, very violent men. And it was experiences at that time that made me understand that all this psychology I'd learned over the years wasn't really helpful in understanding this population. And also, it made me realize it didn't help me understand the context and the impact that the context had on these individuals and their behavior. Very naive looking back. So I started working in the prisons in Scotland, and not very long afterwards we had a whole series of riots. I don't think the two things were correlated, but who knows. But they had a whole series of very serious incidents of hostage taking, which went on for days at a time, 4, 5, 6 days. People were on the rooftops taking hostages. It was so bad that the prison service even asked psychologists like me to come and get involved and advise them about how they should manage these incidents. So, this is the sort of thing I'm talking about, rooftop demonstrations with hostages. It says here, we are all hostages, or long-term mental torture, or this is complaining that a prison officer hadn't been charged with assaulting a prisoner. And this is the sort of impact after a 4-day riot in Barlinnie Prison in Glasgow. Now, experience, I was involved in 4 of these incidents as part of the management team, and these experiences were one of the 3 types of experience which made me appreciate the importance of situational variables when it comes to understanding violence in prison. And what was interesting after the event was the explanations that different people gave to why there were riots, why hostages had been taken, why so much property had been damaged. And there were some critical criminologists called Scraton and his colleagues said, violence is an inevitable reaction to a violent and repressive regime. So they're saying it's the way we treat people which triggers the violence. On the other hand, the official view, the official account, was rather different. And this is the official report after the riot. It said, after the riots, rather than looking to changes to the way in which the prison service as a whole goes about its task, a more productive approach may be to concentrate attention on the individual personality and repertoire of particularly disruptive and violent inmates. So the first quote is saying it's the way we treat people that matters. This quote is saying it's the individual risk factors, it's the personality of the individual prisoners that matter. Now, this is what the officials who ran the prisons were saying, and if a patient said that to you, you'd say that they were in denial. They were, yes. But in England they had similar problems, but not to the same extent, and they took a different view. They said, except perhaps in the case of those prisoners whose behaviour is a product of mental disturbance or abnormality, all our experience suggests that troublesome prisoners present control problems only at particular times in particular contexts. So the English long-term control board saw that the importance of the interaction between individual risk factors and personality features. So 6 months after this series of 7 riots, a strange thing happened. This strange thing happened in the most severe extreme prison in Scotland, a place called Peterhead Prison, which is now closed. It used to be a convict prison, the only one in Scotland, and it was put in Peterhead so as the convicts could build a big harbour there. And the last riot took place in Peterhead Prison, and the special air squadron, our elite troops, went in and took out the hostage and brought him to me to be debriefed after 4 days. I wasn't sure what to say to a man who'd been on the roof for 4 days, but anyway. But 6 months after that riot was completed, we were back there again having a conference, a 2-day conference in the prison with officials from the Scottish office, with prison governors, but critically with 10 prisoners who had been on the roof, who had been taking hostages in all the different prisons in Scotland. And we all sat down together to try and say, how are we going to sort this out? How are we going to improve circumstances? The first proposal was we'll build a brand new prison and we'll put 130 people in it, and they'll have awful conditions, you know, they'll be really locked down, and that's how we'll sort the problem. We'll take out the 130 bad guys and deal with it that way. But if you think about it, if you know about prisons, if you take out 130 bad guys and put them somewhere, what happens? Another 130 come up to take their place, and you're back to where you started. So the prison service realized they needed a different approach to dealing with violent prisoners. And they began to identify a whole series of situational factors which were important, such as the prison being very remote from where most of the prisoners came from, the absence of sophisticated, properly trained frontline staff, a very poor regime, nothing much happening in the prison, no treatment, a lack of a clear policy about what prison is for, and so forth. So that again was another important experience. A number of years later, 20 years later, the climate was rather better, but I was back looking at another riot, this time in Barbados, in the Caribbean, and they had a prison there which had 1,000 prisoners in it. There was men and women, there were people, young people and adults, there were people on remand, people on convicted, people on death row, and they had a riot. They lost control of their prison, over a 3-day period, and they had to house their prisoners in other circumstances till they had a new prison built. And you can see here another picture of the burnt-out prison in Barbados. Now, interestingly for me, going back, it was like being in Scotland, apart from the climate, had been 20 years ago. The same sort of explanations were being put forward. Inmates to blame was one of the headlines. It's to do with the way these people are and the way they behave. Although there was a recognition that insensitive approaches to dealing with people's cultural needs could also have an impact. So Rastas speak out against cutting the locks, their dreadlocks. And again, in Barbados, they were obviously panicking because they brought the psychologists in again. So another sign that there are difficulties there. Desperate measures were called for. So the third thing that made me understand or gave me a clue that situational factors were important was working in a place called the Barlinnie Special Unit, which was a notorious or famous unit in Scotland many years ago. And we had a number of very difficult prisoners there over the period of the unit. And they were brought up in the back streets of Glasgow in the 1950s and 60s. They graduated to street gangs in Glasgow. And here, I don't know if you can see it, here's a man using a cutthroat razor, an open razor that you use for shaving. They then went on to go into, take part in riots. And many of you will see that they can't spell, so that is, I blame the teachers for the riots. And then from that, they moved on to the special unit, and where they discovered art, and they changed their behavior. And one commentator said in the newspaper, you couldn't move for artists and writers growing bloody tomatoes, that says. Now, I was asked to evaluate the effectiveness of this unit, and I looked at the violent incidents of these men before they got to the prison. Most of them had killed at least once. Most of them were psychopathic. Most of them had other risk factors for violence. But I looked at their violence before they came to the special unit, and from that you could work out a predicted level, an expected rate of violence should their behavior continue the same in the unit. And that's what I would have expected, and that's what we got. We got 2 assaults in the history of the unit. And if you look at serious incidents like setting fires, barricading and so forth, you get a similar pattern. Now, of course, you'll be sitting there thinking, why did that happen? And of course, you'll be thinking, well, it must be the great skill of the psychologist who was working there. No, it wasn't that at all, obviously. It was we treated people differently. The situational determinants of violence were different in this particular unit. And things which were obvious were things like the quality of the staff. The staff were well trained. They were trained in techniques for talking people down should they get aggressive. They were told to form relationships, professional relationships with the prisoners so as they could develop relational security. There were more visitors, there were professional visitors who came in. And if you give people more in an institution, you have more to take away. It gives you control in institutions. The emphasis was on relational control rather than physical or procedural control, because when people are psychopathic, particularly, a lot of violence is about saving face. So if you actually confront people, you're more likely to get a violent reaction than if you use other softer ways of dealing with the problem. And the regime quality was higher. They had lots of things to do, lots of activities. Specialists came in to help them learn new skills. So looking back then, being involved in the riots, going to this strange conference in Peterhead, locked in the prison for 2 days with hostage takers, and then working in the special unit. All of these things made me wonder about the importance of situational factors as an adjunct to our understanding of individual risk factors like psychopathy. So this is what we call the popcorn model. It's not original. We borrowed this from workplace violence literature in America, where they like popcorn. But I think it illustrates the point. We can spend lots of time studying the individual pieces of popcorn. We can look at the weight, the shape. We can even use the PCL, the Popcorn Checklist Revised, to assess them. But that's only part of the equation. It's only when you apply heat to the popcorn pan that things start to explode. That's a popcorn model. And I would say our role as forensic practitioners is to try and understand our institutions and try and keep the heat down. Because if the heat comes down, we're not going to get people acting out violently. And that's the sort of general principle of the model. So, together with a colleague, Lorraine Johnson, we developed a method for trying to carry out a structured professional judgment assessment of an institution rather than an individual patient or an individual prisoner. And we went about developing this in the following way. We carried out a systematic review of the literature. So we reviewed some 7,000 papers, of which only 50 or 60 were relevant. And that tells you quite a lot. It tells you that people have not been studying this problem carefully and systematically. And because of that, we also carried out interviews, systematic interviews that we evaluated with people who work in hospitals, people who work in prisons, and people who live in hospitals and prisons. So we talked to prisoners, for example. We then took all that information, identified a number of risk factors, and we then categorized these and put them in conceptual domains, which I'll show you in a minute. And then finally, we developed guidelines to help us assess how you go about evaluating risk factors in an institution. And this is all based on the principles of structured professional judgment, which I mentioned earlier in my talk. So here's a systematic review. We reviewed all the literature on institutional risk factors. We found some systematic evidence, but not a lot because the research hasn't been done. We looked at interviews, and here's a quotation from a prison officer, and he said, "The most powerful tool we've got as prison officers is not shields or sticks or armor, it's the gift of speech. And my mouth has saved me perhaps quite a few times. There have been volatile situations I've been involved in, but I've managed to talk the person down." So the staff are able to identify the importance of relations and interpersonal skills. So we developed a pilot version, and then we evaluated it using systematic case studies in 5 prisons in Scotland. But these are the things that we thought were important. Firstly, we think about, has this institution had a history of violence, and what sort of violence has it been? You know, what drives the violence? What are the qualities of the violence? Is it gang violence? Is it violence of individual prisoners trying to control a drug supply? What is the violence like? What is the physical and layout of the prison like? What is the security like? Is the organization designed to counter violence? Are there anti-violence norms in place, anti-violence values in place, other policies, procedures, practices? Do the staff have proper training in how to manage violent people? Do they have good morale? Because if you've got good morale, it's better, you can function more effectively. And then case management. Do we know who's in our population? Do we know what their problems are? Do we know what their needs are? And do we have programs or other interventions designed to tackle these particular needs? So let me take you through the domains and explain what we're trying to do. The first domain is about the history of institutional violence. Now, in a structured professional judgment approach, you're trying to speculate about what might happen in the future in your institution. And by looking at violence systematically, looking at the frequency and the shape of the violence, it gives you some ideas when it comes to formulating what you think might happen in future events. You want to look at whether the violence is diverse. Diverse in terms of its seriousness. Are there different people doing it, or is it one or two people who are always responsible for the violence? Is it verbal aggression? Is it physical violence? Is it sexual violence? Are there weapons used? How serious is it? Is it in particular locations? Are there different motivations? Are people doing it because they're trying to control drug supplies, or because they belong to a different gang, and so forth? Is violence escalating? Is it getting worse? Is there an upward trajectory of violence? Because that could indicate that there's a psychological stress in the climate, psychological climate of the institution. Or what about changes in complaints? Are complaints going up? Or are complaints going down? If complaints are going down, that might be great, but it may also mean that people are thinking, I'm not going to bother complaining, no one pays any attention, so I'm going to just go and be violent and have done with it. So looking at the reasons why complaints change is important. It's not merely complaints going up as an indicator. So I would like to talk about physical security. This is some Norwegian humor. This is in Stavanger prison where we did some work. And this man is trying to escape by throwing his ball and chain, or the ball from his chain, over the wall. Anyway, physical aspects can be important. The physical environment, resources can be important. For example, is the building well maintained? Is it clean? Is it hygienic? Is there good sanitation? Prisons that are hot, noisy, dirty, smelly, lacking in natural daylight can be problematic. And when we went to Barbados, we found that this was a problem there. The prison had been built by the British in about 1848, and it looked like it hadn't been maintained since then. There were rats, there were cockroaches, there was glass falling from the roof, there was sewage seeping into cells. You know, that was one thing that would make people feel they weren't being valued. And then, how good is the security? Is there good control within the institution? Is there good security to keep people within the institution? And we tend to use what we call the Mercedes model, where you're trying to balance security, control, and regime. Security being perimeter security, control being what happens within the institution, and the regime being what actually goes on within the institution, whether it's work, whether it's treatment, whether it's education. And you're trying to get these things balanced. If you don't have enough security, if you don't have enough control, then the regime expands, but people begin to get anxious because it is the prisoners, other prisoners who actually run the institution. And that makes other prisoners anxious, and that can lead to aggression. Similarly, if you constrain the regime, you tighten the regime so much, people get angry because they are being mistreated. and they feel they're being abused, and therefore they're more likely to be violent. So this is a judgment that people have to make. So physical conditions vary greatly. I've been in prison, many prisons across the world. I usually get let out at the end of the day, which is good. But when you get there, you see that they vary very much in their physical layout. Here is an example. This is a nice Norwegian prison. This is Bastøy in Norway. And here we have people doing group therapy in California. So quite different ways of treating people in these different institutions. Domain number 3 is organizational features. How does your organization function? Is it functioning in such a way that it will drive down violence? Does it have good anti-violence norms, policies, procedures, and practice designed to affect the level of violence? So what is the ethos or the philosophy? Is it a philosophy which says violence is unacceptable in our institution, in our hospital, in our prison? Or is the ethos that, well, these people will be violent anyway and there's not much we can do about it? That's an unhealthful ethos. Is there a good structure? Does the management is it chaotic, or is it negative, and is it ineffectual, or does it have promote collaborative working and communication? Is there someone who's responsible in the institution for reducing the level of violence? Is that their main job, and do they get support from other people to do that job? Are there clear policies about what do you do if someone is violent? How do you deal with them? How do you manage them? What is violence? What is not violence? Do you have clear guidance on that? Because that is important too. Conflict in an institution can be very healthy. It can promote change. How does this particular organization deal with conflict? Does it get rid of the people who say there are problems, or does it try and change in a more productive way? And is it an organization that knows how to adapt to change? So these are some of the things in the organization that we evaluate when we're doing our evaluation with the team from the institution. Now, ethos, philosophy, this is my favorite example of an ethos which isn't very helpful. And it's not from Barbados, it's not from Brazil, it's actually from Britain. And this was said by this man here, who was David Blunkett, or is David Blunkett, who was the Home Secretary at the time of a riot in Lincoln Prison. Fortunately, that wasn't the approach adopted to resolving the conflict. So, the fourth domain is probably the most important domain. It's a domain to do with staffing, staff features. Do you recruit and keep the good staff? Do you get the right people into your institution? Do you train them up? And once you've trained them, do you get to keep them? And do you have policies to do that? Do you have the right range of people with a skill mix? Because we know that people who are inexperienced are more likely to be assaulted, for example. Do you have a range of people from the inexperienced to the experienced within one setting? Are they trained in things which are relevant to reducing violence? Are they competent in doing that? And do they have an approach like the quotation I showed you? The prison officer talking in that quotation was saying that his mouth had saved him many times because he knew how to talk to people well and how to diffuse violence and avoid it happening. And that, of course, comes from experience, but also that can be trained. You can train people in how to do that. And does the staff have good morale? After the Barlini riot, I showed you some pictures of that, 35% of the staff were off sick. Many of them were off sick because of psychological reasons. Of those remaining, the morale was very low. They were scared to go into the prison. And so the problems kept going on and on and on because of poor morale. So morale is an important thing to consider as well. This isn't new. There's nothing new under the sun. People recognized the importance of staffing hundreds of years ago. And this is just a quotation from 1847, the Inspector of Prisons for Scotland, who said, "In some prisons, an unusual degree of good conduct is induced, and the number of punishments kept low by the personal influence of the officers and their care and reasoning with prisoners before resorting to punishment." So getting your staff right, getting them trained properly is very, very important. And of course, the final domain then is to do with case management. Do you actually know who's in your prison? When we went to Barbados, they had no idea of the risks and needs of their population. They didn't know whether they had anger problems, mental health problems, if they had substance misuse problems, if they had gang affiliation problems. They didn't know anything about it. And one of the things we did was to introduce a systematic risk assessment process. What is the mix of the population? Again, to go back to Barbados, they were mixing young men and older prisoners. And they were using older prisoners to control the younger men. If younger men were acting out, they would put them in the cell with older men who would beat them up. So there's that sort of mixing people can be difficult. Or in New Zealand, they talked about the problem of mixing life prisoners with people who are doing short sentences. People doing short sentences can act up. They can be violent knowing that they will get out anyway, whereas the life sentence prisoners may have several years added to his sentence. So they talked about bed and breakfast prisoners in New Zealand, not mixing them with life sentence prisoners because of the problems that produces. Do you have any interventions designed to tackle the risks and needs that you've identified as being important when it comes to dealing with violence? Do you have any programs which might look at anger management, or substance misuse, and other things that we know are important? And what is the quality of life like? Do people get proper visits? Do they have access to family? Can they phone family? Can they get education, and so forth? So those are the domains. How do we go about assessing an institution? And there are a number of steps that we take. The first thing I should say is this is a collaboration with the institution that we go into. So the 7 steps. The first step is to get a group of people within the institution at different levels in the institution with different skills. So we'll have people from the human resources, we'll have people from security, we'll have people from the mental health facilities, and we have a group of people who we train and then tell them that they need to go away and collect data about the institution and how it functions. And they may collect data by going to the files. They may look at sickness, absence records. They may look at the number of violent incidents if it's recorded. Surprisingly, there are many institutions where they don't record violence incidents. They may collect data by doing focus groups with prisoners. They may do staff surveys. They collect data in a variety of ways. And then you decide whether any of the 22 risk factors we've looked at are present or not. And then think about, okay, I've identified poor staff morale as being present. Does that matter? Is it relevant? Will it increase the level of violence in this particular institution or not? And you do, if you go back to the Balinese Special Unit, when I was working there, it was a very old Victorian rundown institution. And though physically it was pretty awful, it didn't really matter in terms of violence because there were so many other things happening which were counter to violence. So you can have a risk you know, a risk factor present, but it doesn't necessarily mean it's relevant. You have to apply some judgment about whether something is relevant or not. You get all your risk factors together and you start to think about why is there likely to be a problem in this institution. You formulate the problem. And you might say, well, there's a problem here with gang-related violence because of this risk factor and that risk factor. And you describe that problem and you describe what you fear might happen. You think that in the future in this institution, I'm worried that there's going to be an increase in sexual attacks on young males by adult males because of these particular reasons. Or I'm worried that this gang is trying to get control of this particular drug supply in this prison, and that's why I'm going to have violence. In New Zealand, for example, violence was happening in prisons because one gang wanted to have the same number of gang members in the high security prison as the other rival gang, and so they instructed people in other prisons to be violent to get transferred up to a different institution. That was happening in Auckland. You then think about what you fear might happen, and then you develop strategies to manage those particular fears, and then you communicate that to whoever has to do the problem, resolve the problem. Okay. So, I started at the beginning by saying that over the years we've got very good, in the last 20 years, at identifying individual risk factors for violence. We know about what we should look at for all the different types of violence. But when it comes to situational determinants, we're just at the beginning. We're just at the beginning of trying to understand what are the salient processes. And so we can now gather our risk factors. We have some sense of what the risk factors might be that pull people out of shape and make them more likely to be violent. And this is where we need to move forward now, is moving to thinking about what is the thing that interacts between the situation and the individual? What is it in the person's perception, their thinking, that influences their likelihood of going on to be violent, and how does the institution impact on that? And if you look at, well, we've now used the prism in about 25 different places, and there seem to be a number of themes coming out. If the risk factors engender a sense of injustice, people are more likely to be violent. If it increases the tension and uncertainty, people are more likely to be violent. Or if they're deprived of things that they think are reasonable, like decent food, decent access to visitors, decent access to phone calls to their family, access to lawyers who will help them with their case. Again, going back to Barbados, some people were in prison on remand for 4.5 years before they actually got to court. They're deprived of their liberty without due process. Do you have a loss of agency? If you feel you cannot affect what's going on in your life, that may have increased it. If you get frustrated because you're trying to complain and you're trying to move things forward, but you're not getting a response. Or if you feel you're being disrespected. And disrespect can come in many ways. It could be how staff treat you day in, day out. It could be keeping you in conditions which are unsanitary, poor food, hot, where you have to defecate in front of other people. Those sort of things are some of the risk processes that lead people to be violent. And this is what we have to begin to unpack from a theoretical perspective if we want to understand situational violence determinants in a clearer, more systematic way. So we've used PRISM in a number of settings now, I think about 25. It can be used in a number of different ways. It can be used as a critical incident review. So in Scotland, in one of our psychiatric hospitals, we had a patient kill another patient, and so we were able to go and do a critical incident review using this approach. And of course in Barbados, when we went to look at the fire and riot there, we used an early version of PRISM to try and understand what was happening. It can also be used for stock taking, and that's generally how it's used. People will say, let us look at our institution. It's going along okay. Can we improve our practice? Can we reduce the level of violence and level of self-harm and other things by looking at it? And then, of course, it can be used for strategic planning. Earlier this year, I was working with colleagues in Denmark, and in Denmark they have a high secure hospital, only one very high secure hospital, and they are moving to a new building which is 60 kilometers away from the current building. And they're trying to think about what might go wrong, what might be the problems, and we are using the PRISM as a way of trying to understand and unpack that. So, I started by arguing that one of the key tasks of forensic practitioners working in hospitals and in prisons is to prevent violence. That is a key thing that we should be trying to work with. And we have made amazing strides in the last 20 years in our ability to assess how individuals are at risk for future violence. But we haven't really done enough on institutional violence, in my view. Now, I don't know if any of you know the work of Steve Pinker, but he's very recently published what I think is a very important book for those of us who are interested in violence. It's called The Better Angels of Our Nature, Why Violence Has Declined. This is a quotation from Abraham Lincoln's inaugural address. I didn't know that, but I looked it up in Google and discovered that's what it was. And basically, he's looked at the history of violence and has shown that over the centuries, and indeed over the more recent times, decades, it is clear that violence can be driven down, can be prevented by the proper use of social forces. And I think as forensic practitioners, we can add our little bit to that task to try to prevent violence. And I'll close with a quote from Pinker's book. He says, "For all the tribulations in our lives, for all the troubles that remain in the world, the decline of violence is an accomplishment we can savor." And I think that is something that we should be endeavoring to do as forensic practitioners. So thank you very much for your attention.